Hello, guys. So contrary to the title, I'm not going to give you what the media wants you to believe, and I'm not going to give you false information. I'm just going to give you just accurate information about the facts out there right now. Um, so let's just get right into it. So a little bit about myself. I'm actually in med school right now, um, and I've come across something on one of our research platforms and one of our study platforms called AMBOSS. They're continually researching about COVID-19 stuff. So it was last updated September 27th. I'm just going to get right into the drug. So let's just open all of these. We'll go right to the culprit here. So this is under experimental drugs for treatment. You can see there's a nuclear import inhibitor called Ivermectin, and they put a source to here. So I'll link this into the to the description below, and what's going to pop up. I don't know why it's not showing right now, but there was a view the entire article thing, and there was also an area where you can actually download the paper. I don't know why it's not popping up here. Maybe it's because I have it on expanded view because I don't want you to see my my other search bars here. But I will link it. I'll also link you the article as well. This is um, the uh, the article itself. So this is what pops up, and in this article, I'll just get right into it. You can read a bunch of this information, as much of it as you want, just so you are informed yourself. But I'm just going to give you like a just brief summarization. So like so it's saying that ivermectin is FDA approved. It's a broad spectrum antiparasitic agent. However, they used it on a bunch of different things, and it's been tested on a bunch of different things as well, such as like dengue fever, Venezuelan equine encephalitis virus, influenza. So this has been used on a lot of different things. And what they found was that so what they did is that they infected some cells. I'll just put it very simple. They pretty much infected some cells with the coronavirus. And essentially, what happened is after 24 hours of of ivermectin working on these cells that are infected with the COVID-19, um, like with SARS-CoV-2, what they found is that there was a severe reduction um, of the viral substances. Simple to put it that way. So it went from like 100% all the way down to about like 0.1 ish percent. And then on the second day, which is like 48 hours later, they found that it went down by, I think the number was 99.98% is what it went by down. Sorry, that it went down by. Um, yeah, we had equating to 99.98% reduction in viral RNA samples, and there was no toxicity observed with the ivermectin at any of these concentration levels. Again, read it, see what it says, inform yourselves. Another thing that I wanted to show you is, you know how the media is always saying, oh, it's bad, causes toxicity, you shouldn't take it, blah, blah, blah. Like whatever the media wants to push, they can push it, I guess. But we have another website here called Medscape, and it tells you everything that you want to know about a drug, all right? Um, so over here, like you can see what it's usually used for, like head lice, paralysis, scabies, like river blindness, like all of these different things. And so these are like, if you were to take it with like these other drugs or medications, what could happen type stuff. Um, for the adverse effects, like don't be alarmed that it says all these things. These are like very common. Like if you take any other drug out there, most drugs have most of these symptoms. Maybe not like mild EKG changes, but like they just have to put it in there because whenever they were testing the drug, um, that it was for like that it was used for, like the patients that had like these type of problems or whatever, whenever they do like phase 3 or phase 4 testing, um, whatever problems patients have, they have to report it here. Um, so these are some like cautions to take and everything, and then it also said something about right over here. So this is what it does. So this is what the drug does, right? And in the paper, it will tell you why the drug works the way it does um, by closing this ion channel. Um, and then let's just go right into it. So it's saying that this medication is used to treat certain parasitic roundworm infections. Curing parasitic infections helps to improve your quality of life. In people with weakened defense immune systems, curing roundworm infections can reduce the risk of developing a severe life-threatening infection. Ivermectin belongs to a class of drugs known as antihelmintics. It works by paralyzing and killing parasites. Ivermectin is not recommended for coronavirus disease, also known as COVID-19, unless you are enrolled in a study. Talk to your doctor about the risks and benefits. So the fact that it says unless you are enrolled in a study tells me that it's being tested on, and based on the paper that I'll link you here in a bit, it's I think it's working, and I don't know what's exactly happening. I don't know why the government's pushing the vaccines as they are right now, because it hasn't even been 2 years. I myself am vaccinated, but because it's been less than 2 years, there's no way, like as a future physician, that I could force people to take this vaccine and just force it upon them. There's no way that I can do that. That's just unethical at that point. Um, these are my findings. I guess let me know what you think. Um, and just share it with your friends and family. But yeah, just stay up to date on a lot of things. Don't just take what the media says and deem that to be true, because most of them, as we know, most of them aren't even doing their research. They're just saying what the other person is saying. That's what I'm finding these days. But anyways, guys, take care and have a blessed day.